In Module 1, we will discuss the basics of erectile dysfunction, or ED for short. We will cover the following topics: define erectile dysfunction, explain what holistic healing is, teach you the anatomy of erections, go through the causes of ED, and analyze what are the root causes of your ED. So what is erectile dysfunction, or ED? Well, the Mayo Clinic defines ED as the inability to get and keep an erection firm enough for sex. Now, ED is characterized by various symptoms that affect a person's ability to achieve and maintain an erection, as well as a decrease in sexual desire. Some common symptoms include persistent difficulty in gaining an erection, difficulty in keeping an erection, and a reduction in sexual desire, also referred as low libido or low sex drive. Now, to assess the severity of ED, the Sexual Health Inventory for Men, also called the SHIM, it's a questionnaire that is often used as a self-test survey. Now, this questionnaire helps individuals determine the level of ED they may be experiencing. And some of you may have already filled out the SHIM questionnaire. Now, if you don't have a copy of this questionnaire, you can download one from this course. Now, I will go into more detail about this questionnaire later in this module. So what is holistic healing? Well, one approach to healthcare is holistic healing. Now, in traditional medicine, oftentimes we focus on just healing the physical body, but we forget that there are other aspects of health. There are also the mental and spiritual aspects. So with holistic healing, we focus on the body, the mind, and the soul. Now with the body, we look at the physical aspects, physical nutrition, exercise, sleep, diseases. With the mind, we look at the mental aspects, knowledge, emotions, behavior, psychological. With the soul, we look at the spiritual aspects, culture, beliefs, ethics, values, relationships, religion. So in this course, we will be taking a holistic approach to overcoming erectile dysfunction. So hopefully by the end of this course, you will be able to identify the root causes of your ED within your own body, your mind, and your soul. Now you will learn how to address these root causes towards overcoming your ED and learn ways to prevent ED in the future. Now let's talk about the anatomy of erections. First, the basics. Now here is a diagram of a cross-section of the male's sexual organs. You could probably spot the penis. And inside the penis are two chambers or cylinders called the corpus cavernosum. They are side by side to each other. This is where blood flows into the penis in order to stiffen and enlarge the penis and achieve erections. Also in the penis is the urethra, a tube where urine travels from the bladder through the penis. And there are the testes, two of them. This is where sperm is made. Now, upon ejaculation, sperm travels from the testes into the vas deferens and down to the seminal vesicle and prostate, where the semen is mixed with sperm and exits through the urethra and out of the penis. Now, people don't usually think the brain as a sex organ, but it is. The brain is the largest and probably the most important sex organ in the body. This is where erections begin. It all starts with some stimulation, an image, a thought, a touch, smell, taste, or any other stimuli. PubMed states, evidence suggests that the most important structures of the brain for erections are the frontal lobe, cingulate gyrus, amygdala, thalamus, and hypothalamus. The brain then sends nerve impulses and chemical signals into and around the penis. Here are cross-section diagrams of a flaccid and erect penis. You can see inside the penis is mainly comprised of two chambers called the corpus cavernosum, which is made up of a maze of arteries like a sponge. Now, there is another chamber just below called the corpus spongiosum, which surrounds the urethra. Also, there are arteries that bring blood into the penis and veins that removes the blood from the penis back toward the heart. As I mentioned before, during arousal, nerve signals from the brain travels down to the nerves in and around the penis, causing the muscles of the corporal cavernosa to relax. This allows the blood to flow in and fill the open spaces in the two corpora cavernosa, making the penis expand and creating an erection. The veins in the penis are pinched so that blood is prevented to pump out and remains in the penis so that the penis remains firm and erect. With continuous stimulation of the penis, it remains erect. The brain continues to send signals of excitement to the penis, to the point where the nervous system tells the testes to release sperm through the vas deferens, the seminal vesicles, and the prostate. That is when ejaculation occurs, releasing sperm and semen. Usually after sex, the brain instructs the arteries to slow down the blood flow to the corpus cavernosa, and the veins open up to allow blood to flow back out, and the penis becomes flaccid again. Neurotransmitters are chemical substances that play a crucial role in communicating between the nerve cells in our bodies. They are responsible for various physiological functions. During sexual activity, specific neurotransmitters are released, contributing to sexual response. Now, these neurotransmitters include testosterone, oxytocin, dopamine, and serotonin. Maintaining a balance of these neurotransmitters is important for normal sexual function and erections. Disruptions or imbalances in these neurotransmitters can impact sexual function and may contribute to ED. I want to talk briefly about nitric oxide. Nitric oxide, or NO, is a vital molecule that aids in the relaxation of muscles in the arteries throughout the body. And in the penis, NO plays a crucial role in relaxing the muscles, which allows for increased blood flow and the maintenance of an erection. So having a sufficient amount of NO in the penile tissue is crucial for healthy erections. Now, more discussion regarding the significance of NO will be covered in a future module. Now that you are familiar with how erections work in the body, I want to talk about erectile dysfunction itself. So, what is erectile dysfunction, or ED? Well, fundamentally, ED is a lack of blood flow going into the penis to achieve an erection. It's also the leakage of blood flowing back out of the penis to maintain an erection. Let's briefly explore the causes of ED within the body, mind, and soul. Conditions that can cause and contribute to ED regarding the physical body include vascular disease, such as atherosclerosis, or also known as clogged arteries or plaque buildup in the arteries, neurological disorders such as multiple sclerosis, high cholesterol, high blood pressure, diabetes, and injuries to the brain, spinal cord, penis, or prostate. Also, there are certain medications that can contribute to ED, including antihypertensives for high blood pressure, antiarrhythmics for irregular heartbeats, and antidepressants for depression. There are lifestyle conditions that also can contribute to ED, including obesity, poor diet, excessive alcohol, drug use, and lack of sleep. Now, regarding the mind, there are some key factors of the mind that can contribute to ED. That includes intellectual, meaning your knowledge about sex, emotional, including your mood, like if you're sad or angry, your attitude towards sex, like if you're scared or negative about sex, past psychological trauma, such as PTSD or post traumatic stress disorder, depression, and anxiety. Factors related to your soul that may contribute to ED may include religious beliefs. Do your religion's beliefs affect your attitude about sex? Your own personal beliefs, ethics, and your own values? And your relationships with your partner or partners, family, friends, and community. Now, we've mentioned about the Sexual Health Inventory for Men, or SHIM, which is a standardized questionnaire designed to evaluate the level of ED. It is commonly used by healthcare professionals and therapists to track the progression of ED treatment. Now, the questionnaire consists of 5 questions, and the total score obtained upon completion determines the level of ED severity, and it ranges from none to severe. The SHIM questionnaire serves as a valuable baseline for monitoring personal progress throughout a treatment course. It is recommended to share the results with a healthcare provider for further assessment and guidance. A downloadable and printable copy of this questionnaire is available in this course. Let's go through the questions. Question number 1. Over the past 6 months, how do you rate your confidence that you could get and keep an erection? Score yourself a 1 if it's very low, 2 if it's low, 3 if it's moderate, 4 if it's high, or 5 if it's very high. Question number 2. Over the past 6 months, when you had erections with sexual stimulation, how often were your erections hard enough for penetration, meaning entering your partner? 0 if you had no sexual activity, a 1 if you're almost never or never, 2 a few times, much less than half the time, 3 sometimes about half of the time, 4 most times, much more than half of the time, or 5 almost always or always. Question number 3. Over the past 6 months, during sexual intercourse, how often were you able to maintain your erection after you had penetrated or entered your partner? 0 did not attempt intercourse, 1 almost never or never, 2 a few times, much less than half the time, 3 sometimes, about half the time, 4 most times, much more than half the time, or 5 almost always or always. Question number 4. Over the past 6 months, during sexual intercourse, how difficult was it to maintain your erection to completion of intercourse? 0 did not attempt intercourse, 1 extremely difficult, 2 very difficult, 3 difficult, 4 slightly difficult, 5 not difficult. Question number 5. Over the past 6 months, when you attempted sexual intercourse, how often was it satisfactory for you? 0 did not attempt intercourse, 1 almost never or never, 2 a few times, much less than half the time, 3 sometimes, about half the time, 4 most times, much more than half the time, or 5 almost always or always. Now, total up your score and see where it falls into. This will help you determine the severity of your ED. If you scored a 1 to 7, then you're classified as having severe ED. 8 to 11, moderate ED. 12 to 16, mild to moderate ED. 17 to 21, mild ED. And 22 to 25, no signs of ED. In wrapping up this module, please review the information presented regarding the causes of ED. Evaluate and think about factors that may be contributing to your ED pertaining to your body, mind, and soul. Are you able to make modifications to these factors? Do you need additional help and support from your healthcare provider, your partner, partners, family, friends, community? In our next module, we will focus on the body, physical causes of ED. We'll talk about diseases and disorders, medications, and lifestyle habits.